Hi there.
How are you?
Fine,
Come in,
thank
please.
you.
Okay, well, you're back to talk about your results. We've got them here. How did you get on with the esophageal test?
Yeah, it was fine. It was a bit strange having a tube up my nose, but it was fine, just a bit uncomfortable.
Good, okay. And can I ask you, over the course of the test, the 24 hours the test was done, did you experience a reasonably normal number of reflux symptoms?
Yeah, it was pretty typical.
It was typical. Okay, excellent. Well, the results, I think, reflect that. If you remember, there are two parts to it. The first bit actually measured how well you were able to swallow and tested the muscles and the nerves in the esophagus, and it's shown that more or less they work normally. But interestingly, it did show that the valve, the lower esophageal sphincter, the valve at the bottom of the esophagus, is weak. And of course, that's the primary problem. That's why you're experiencing your symptoms. The second part of the test, which was the Reflux Studies, they have shown that you've got definite evidence of abnormal amounts of reflux, and in particular, quite large amounts of acid coming back up into the esophagus from the stomach. And as well, if you remember, every time you experienced one of your symptoms, you pushed a button on the little box, and there's the test recorded a correlation between you pushing the button and recording the reflux event. So that's highly suggestive that it's the reflux which is causing your symptoms. Okay. So all that confirms the diagnosis and suggests that, in principle, you could benefit from surgery. Now, when you came in and we did the endoscopy, you remember we found the small hiatus hernia, which again is consistent with reflux. Most people who have a hiatus hernia will have reflux as well. So I think when you came in, we had a long discussion about the different options, the Nissen fundoplication options, the Linx, and we talked about what they involved and the pros and the cons, the risks and the benefits. And hopefully you've had a chance to look at the website and do lots of other reading. Yeah. So I guess the question is now, what do you want to do? Do you have any further questions? What's your preference?
Yeah. No, I have read up a lot more on it and spoken to my GP more about it, and I've decided I do want to go ahead and have the Linx. I think I said to you before, I didn't really like the idea of the Nissen, and I think I'm right in thinking that the Linx has far fewer side effects, doesn't it?
Broadly true, exactly right. If you remember, one of the reasons that people have rather gone off the Nissen, or it's put some people off from having it, is because perhaps 10 to 20% of patients can experience side effects following the surgery. So remember, the operation in a fundoplication involves wrapping a bit of the stomach around the bottom of the esophagus. So that creates a high pressure zone which stops the reflux, but it isn't a normal valve, it doesn't relax. So that means that a proportion of patients find that they can't belch, find that they can't vomit. And if after you've eaten, if you swallow some air, as most people do, that can make you feel bloated. It can mean you get windy abdominal pain, which can be unpleasant. And if the air doesn't come up one end, it's got to come out the other end. And that can be embarrassing. With the Linx, remember, the magnets relax so that you can belch and you can vomit normally. And as a consequence of that, you don't get these gas bloat symptoms. Both operations, you can get dysphagia or swallowing difficulties afterwards. But again, with the Linx, it does tend to wear off over time. So the vast majority of patients who experience problem swallowing, they'll find with the Linx that will resolve on its own.
Okay, and how long does the Linx last? Is there any point when it needs to be replaced?
Well, that's a really good question. The fundoplication operations undoubtedly have a failure rate over time. So studies have suggested that perhaps 5 years after patients have had fundoplication, on average, perhaps 30% or more will be back taking regular antacids. After the Linx, the published evidence is that that's not the case, and in fact that in terms of regurgitation, for instance, more than 90% of patients, their regurgitation will be abolished, and 5 years later, that will still be the case. So the effect seems to be maintained over time.
Well, that's great. And in terms of the operation, what's the recovery like?
Most patients can either have the operation, go home on the same day, or stay just one night in hospital. And most people will be back to normal activities, day-to-day activities, about a week later. And then in terms of getting back to complete normality in terms of swallowing, I usually say to people you need to leave it about 3 to 6 months to judge the final outcome. But in terms of the recovery from the surgery, it's rapid.
And what are your results like? Well,
again, a good question. We actually think it's really important people can see what results surgeons and teams treating reflux have. So we publish our results on our website, on the Reflux UK website, so you can see all that yourselves. Our results are consistent actually with everybody else's results, insofar as overwhelmingly the vast majority of patients find that their symptoms are abolished, and they're delighted with the result. But you can have a look at the website and see them.
Fantastic. And am I right in thinking that the reflux does stop pretty much straight after the operation?
Yes, it's interesting. A lot of patients, you see them afterwards and they say, this is the first time in years that I've not had reflux overnight, for instance. So yeah, the answer to that is yes, most patients will find an immediate relief of their symptoms, although as I said, I usually say to people, you need to wait perhaps 3 to 6 months at the outside before making the final judgment.
Well, I'd like to go ahead with it then, please.
Okay, well I'm happy to go ahead. I think you're likely to benefit, and we'll find a date that suits and arrange to get you in.
Okay.
Look forward to seeing you then.
Thank you.
Okay.